Let's talk about Moderna. How significant is this, and how would the Moderna vaccine work alongside with Pfizer's?
Well, look, it's very significant. You now are going to have two manufacturers in the market producing significant supply. The United States government has secured 200 million doses of Moderna's vaccine between now and June. And that's going to be delivered over the first and the second quarter of next year. And as your prior guest said, they're going to be delivering up to 20 million doses this year. So this is going to be a lot of supply coming into the market. The vaccines are very similar. They work through a very similar mechanism. They're mRNA vaccines. So basically what you're doing is you're giving the patient a genetic sequence that codes for the production of a protein found on the surface of the coronavirus, what we call the spike protein. And when that genetic sequence is taken up by our bodies start to produce that protein. It reads the genetic sequence and actually starts to produce the protein. And once that protein is in our bodies, then our immune system kicks in and develops antibodies against it. And that's how the vaccine works. They both work through a very similar mechanism.
See, I told you he'd explain it. All right, I need to ask you about this. There are reports out there that states believe they're going to get less Pfizer doses than they expected. I saw you on our sister network, CNBC, earlier today, and you said you think that vaccines are being deliberately held back by the government and that we could actually be immunizing a whole lot more people. To that, I need you to explain this to me.
Well, look, they are being throttled, and I think the government has admitted that they're doing that. They're holding back doses. In part, they say they want to hold back a second dose for everyone who receives the first dose. I think that that's not the right decision. I think they should be leaning forward and trying to get more doses in people now and have some confidence that the manufacturing is going to keep up. With respect to Pfizer, and as you mentioned, I'm on the board of Pfizer, the 25 million doses that the company's promised for December have largely been manufactured. And many more of the lots are released, ready to be shipped, than what are being shipped, actually. HHS said last night that there's 7 million doses available to be shipped. By the end of this weekend, there'll be many more than that. So they could be shipping more than they are. I think that they're trying to manage the supply chain. I think they're trying to get Moderna and Pfizer to parity. I think they might be concerned that if they stuff too much vaccine into the supply chain, some of it could go unused, perhaps. I don't know exactly what their thinking is. This is what I would be speculating as to why they're doing that. My advice would be try to get as many shots in arms now as possible, because we're at the peak of the epidemic right now. We're entering the peak, and we know these vaccines are partially protective even after the first dose. So if you can get more first doses in people right now, you can start to have an impact on the epidemic we're going through. A vaccination this week is going to be far more valuable from a public health standpoint than a vaccination 5 weeks from now. So I would try to be vaccinating more people than they are, and as many people as possible right now.
I want to ask you about access to this vaccine. I just had COVID, and I can say that access to testing is wildly different depending on how much privilege and connection you have. Are you concerned that we'll see the same thing with the vaccine distribution?
Well, I'm concerned that we're going to see a lot of heterogeneity from state to state. And I think some states will do a good job getting the vaccine out to communities that are eligible to be vaccinated. I think some states are going to struggle. They're not going to have the resources and the systems in place. And we're seeing that with the antibody drugs as well, where only 5 to 20% of the antibody drugs that are available have actually been used. And a lot of it's sitting on a shelf. And in some states, none of it's been used, from what I've been told. So I worry that that last mile is going to be the challenge for some states that don't have good systems in place. And we are going to be vaccinating at least through the month of January and probably into February, very select populations, elderly populations, vulnerable communities, certain essential workers. And so states are going to have to go out and find those individuals, get them into vaccination sites, encourage them to get vaccinated. That's a very hard undertaking. Right now, in December, we're vaccinating healthcare workers and people in nursing homes. That's a little bit easier because we know where the people in the nursing homes are, and we know where the healthcare workers are. They're around the hospitals, and so we can distribute these through the hospitals. Once you're going into the community, that's going to be a much more difficult challenge. I think what we're going to see is a lot of heterogeneity across the country, and it's going to feel a little bit unfair because someone in one state may get vaccinated and a very comparable person, a similarly situated person in another state, may not be eligible and may not have access to it.
Hey there, I'm Chris Hayes from MSNBC. Thanks for watching MSNBC on YouTube. If you want to keep up to date with the videos we're putting out, you can click subscribe just below me or click over on this list to see lots of other great videos.